Hey, this is Dr. Thomas at Integrity Dental, and we've been getting a lot of questions about dental implant restoration specifically. So I wanted to try to take a few minutes and address some of the most frequently asked questions concerning dental implants.
Dr. Thomas, what is dental implant restoration?
Okay, dental implant restoration is subtly different than just dental implants. The dental implant is technically the part that is encased in bone. It's a screw, a titanium screw that goes into the bone and the bone fuses to it, becomes part of the bone. That part is what holds your restoration. After that is healed, and that takes about a bare minimum of 3.5 to 4 months to heal that implant or the screw that's in the bone. There's an abutment that is attached to that. It screws into the implant, and then a crown is attached to the abutment. There's also another style where it's an abutment crown already kind of fused together outside the mouth, and that's just screwed directly into the implant. So it's an abutment crown fusion outside the mouth, so you don't have to separately cement that, but still still the same general principle there.
What does implant restoration entail?
Implant restoration in our office specifically entails making sure the implant base, the screw, has healed, and once you have verified that that's all ready to go, you put the abutment in, which is painless. You just unscrew a healing cap that's on top of the implant. Then you scan the abutment. Sometimes there's a little bit of preparatory work that goes into making the abutment fit the patient. So there can be some drilling, whether outside the mouth. Most of the time we just do ours outside the mouth. We prep and then screw it in once we have it prepped the way it needs to be, shaped the way it needs to be. And then you scan that and make a crown to fit over top of the abutment.
How can I make my dental implants white again?
How can I make my dental implants white again? Well, they should always stay white. What sounds like may be happening with this question is that maybe you've had some recession or gum disease or bone disease around the implant, and so the gums have receded away and show the edge of the actual screw, which is silver or gray. And in that case, you may have a bigger problem. That means that your implant may be failing and it may need to be either repaired or could need to be replaced.
Is it possible to do screw-retained crown restorations of single implants?
Absolutely, yes. The way that we do ours is cement retained, but once you re-access or drill through the top of that crown that's cemented on top of the abutment, it becomes a screw retained. So it's really a matter of technicalities, how you define it, but pretty much all single tooth implants are actually screw retained implants. It's just a matter of whether or not the abutment and the crown are cemented outside the mouth or cemented directly inside the mouth. And there's positives and negatives, pluses and minuses to both options, but our preference here is the cement retained, and then eventually, or if you have a problem with it and it needs to be unscrewed, then it just becomes a screw retained.
How many years can you keep a dental implant?
How many years can you keep a dental implant? There is no expiration date on dental implants. If you take good care of them, they are often a lifetime restoration. 40, 50, 60, 70 years potentially there, if it is well maintained and kept up at home. But just like teeth, you still have to brush, you have to take good care of your implants because they are susceptible to gum disease, to getting bone disease for the screw portion that is encased in bone. And if you lose bone and get infection around your implant, you could be dealing with a failure or losing that implant.
How many times can dental implants be replaced?
Again, there's not a set number of how many times a dental implant can be replaced. A dental implant is neat because it's all metal or ceramic parts. They're not susceptible to getting a cavity in them. You can't get a cavity there. You can only get gum disease. When you get gum disease around an implant, they have to be removed. You take it out and you regraft or just replace an implant depending on what kind of bone you have in the area at the same appointment. It really just depends on what kind of bone you have left to work with, how much bone grafting you may need. Eventually you might lose, I mean, if it's a regular thing like you're doing, which it sure shouldn't be. Implants are very successful, but if you're replacing it 2 or 3 times, you may have lost too much bone to where it's not possible, or you have to do some significant bone grafting to be able to redo it another time.
How common is dental implant failure?
Dental implant failure is not very common. The success rates for about a 15 to 20 year success rate for dental implants is about 94% industry-wide, which is pretty darn good compared to all the other dental stuff we do. It's just as good as most of your crowns and your root canals and fillings and things like that. Has about the same, if not maybe even a little bit better, success rate and longevity.
What is the most common reason for implant failure?
Most common reason for implant failure is usually poor hygiene and getting gum disease and bone disease around the edge of the dental implant or the screw that's in the bone, and it either becoming loose or the infection causing enough pain to where it needs to be removed. Second would be poor workmanship, which can happen if an implant is not done well with a skilled professional. That can be another cause why an implant would fail.
Can you save a failing dental implant?
Sometimes, yes. It's not a guarantee, but there are procedures that we can do to halt infection, to stop infection, and resuscitate and implant, so to say. But it can be tricky, and it's not 100% of the time that's an option there. It depends on how much disease, bone loss, gum disease there already is in place.
How can you prevent dental implants from failing?
The best way to prevent a dental implant from failing is to clean it just as well as you clean your teeth, unless you don't clean your teeth well, but you need to clean them well. Brushing and flossing, well, brushing twice a day, flossing once a day is your best bet there.
How long does implant restoration take?
Implant restoration takes about the same amount of time as a crown restoration in our office. A crown, you drill down, shave down the sides and the top of the tooth and make room for a shell or a crown to go over top of that. We do the same thing with an implant. You put in the abutment that screws into the implant body that's in the bone, in the patient's bone, and then you prep that a little bit, scan that, and create a crown to be cemented over top of that, the same way that it's cemented over the stump of a tooth that you're doing in a regular crown procedure. So usually about 2 hours in our office.
How do I know when my implant is ready to restore?
Your implant is not ready to restore after the surgical appointment, where you put the screw into the bone, so to say. You're not ready to restore that any before 3.5 months. That would be about the soonest. Unless there are some special new implants coming out that they claim they can cut the healing time in half. So maybe 1.5 months to 2 months you could potentially restore them, but those are very expensive and they're not very commonly used yet. So the typical soonest you can restore an implant is about 3.5 months after it's been placed. Some doctors elect to wait 6 months or longer.
Call to action.
Well, we love to do implants at Integrity Dental. That's one of my favorite procedures personally, and they're very successful. The technology that has been put in place in our office is awesome, to where those implants are just not nearly as painful as what you might think, and they're so very successful and so very beneficial to a patient's overall health. To be able to chew again just as good as you can on real teeth is just a wonderful thing for patients, and can get you back to functioning like you did when you had a full set. So if that is something that interests you or you'd like more information, we would love to talk with you more about that. We'll do a free consultation at Integrity Dental, or we will help you get some information, even just over the phone, at 719-545-2468 on how the process works.